Hello student. Hello student. Today we'll learn about the upper limb bone scapula. Scapula is a large triangular and flat bone lying at the posterolateral aspect of the chest wall opposite to the second to seventh rib. It is most important to know that it is lie opposite to the second to seventh rib from backwardly and forwardly, which lie in the posterolateral aspect of the chest wall, and it also forms a part of the shoulder girdle. Now, the next part will read about the side determination of the scapula. To know the side determination, we will have to know 3 to 4 things about the side determination. I already mentioned in my previous video that you have to know about the anterior posterior view, medial lateral view, and superior inferior view. Now, in case of side determination, the first part is the glenoid cavity should face forward, laterally, and slightly upward. The most important part is it is the laterally, the glenoid cavity. So we'll know what is glenoid cavity now. Okay, what is the glenoid cavity? See, this this is the glenoid cavity. Small circle. This is the glenoid cavity. Runs locate in the lateral portion of the scapula. So it will lie laterally. Now come to the second portion. The dorsal surface bearing the spine. Dorsal surface which lies backward. The dorsal surface bearing the spine should face backward. The, the most important point here is the spine should face backward. Now we'll know about the spine of the scapula. What is the spine of the scapula? Yeah, we'll know. Yeah, here is this whole thing. This whole thing is the spine of the scapula, which lie backward or posteriorly. Okay. Now, the next thing. Next is the inferior angle. Yeah. Inferior angle should face downwards. Now, from here, from the number 1 point, we know about the medial lateral aspect. So, medial lateral aspect, here comes the glenoid cavity lies laterally. Now, from the second point, we came to know about the anterior posterior. In case of anterior posterior, we should go through the spine. Spine lies posteriorly or backwards. And in case of third point, the inferior angle should face downward or inferiorly. Now we know about the inferior angle of the scapula. This portion is the inferior angle. This is the inferior angle. Yeah, this is the inferior angle. this. Again, this is the inferior angle of the scapula, which lie downwards. Okay. Now we will go to the next point, which is the coracoid process. The coracoid process should point forward and slightly lateral. The coracoid process will lie forward and laterally. Now we'll know about the coracoid process. Which one is the coracoid process? In the scapula, we will know about two processes: coracoid process, acromion process, and spinous process. Now, which one is the coracoid process? In this, we will know about the coracoid process. Okay, so picture. Go to the picture of the coracoid process. One minute. Yeah, this one. One minute. This one is the coracoid process. Okay, which lies forward from this point. We know the coracoid process point forward and slightly laterally. So this one is the coracoid process, and this one is the acromion process, and this one is the spinous process or spine. Okay. Now the next point. The now comes to the main point, which is the scapula possesses two surfaces, three borders, three angle, three processes. Huh? What are the two surfaces? The costal surface and dorsal surface. Here, from this point, we came to know about that the dorsal surface lies backward. So, in case of this surface, costal surface means costal surface means the anterior surface, and the dorsal surface means the posterior surface. So, what are the surface? Costal and dorsal surface. One is the anterior surface, costal surface means anterior surface, and dorsal surface is posterior surface. And here are the three borders. Three borders are the lateral border, medial border, and upper border. Now we know about the lateral border, medial border, and upper border. What are the? This one is the lateral border. This one is the medial border, and this one is the upper border or superior border. Now, how can we know this one is the lateral border? Because from that point, we know that the glenoid cavity lies laterally. This is the glenoid cavity. So, this one will be the lateral border, and this one will be the medial border, and it is the upper border. Okay. Now, from next point, the angles. The angles superior angle, inferior angle, and lateral angle. Superior angle, inferior angle, and lateral angle. And from here, the lateral angle bears the pierce apex articular surface or glenoid cavity. The pierce apex articular surface, which is called as the glenoid cavity. The glenoid cavity articulates with the head of the humerus. Okay. Mm, you now will know about the superior surface, inferior surface, and lateral surface. Which are they? Superior surface, superior angle, inferior angle, and lateral angle. Superior angle, this one is superior angle. This one is inferior angle. This one is superior angle, and this one, the glenoid cavity itself, is the lateral angle. Okay. Now the fourth point is the processes. What are the processes present? I already told the spinous process, acromial process, and coracoid process. The spinous process, acromial process, and coracoid process. What are they? This one is the coracoid process. No? This one is the acromial process, and this one is the spinous process. Okay. Now we'll know details about the surface, borders, angles, and processes. First come the surfaces. The costal surface, or the anterior surface, which faces forward and medially. It is concave and hollowed, called the subscapular fossa. In the it is concave and hollowed, called as the subscapular fossa. Now, what is the subscapular fossa? You know. This portion is the subscapular fossa. Okay. And it has a strong rounded ridge. It has a strong rounded ridge near the lateral border, from which the ridge is separated by a groove. It helps the serrated anterior to rotate the scapula forward. Strong rounded ridge near the lateral border, from which the ridge is separated by a groove. We know about the ridge. Strong rounded ridge. Here it is the ridge. Strong. You can see the strong round ridge, and once a border. Yeah, yeah, yeah. It is separated from the subscapularis muscle, from the serratus anterior muscle. It helps the serratus anterior muscles to rotate the scapula. Okay. It bears the oblique ridge, which gives attachment to the intramuscular tendons of the subscapularis. And lateral third of the surface near the glenoid cavity is related to the subscapularis, and between it and the bone lie the subscapular bursa and the branches of the scapular and circumflex scapular vessels here. Okay, so this one is about the costal surface. Now we'll know about the attachment or muscle attachment of the costal surface. I already told there are two muscle attachment of the costal surface. Here one is subscapularis, one is serratus anterior. This this whole muscle is subscapularis, and there is the serratus anterior. Okay, yeah, attachment. The subscapularis. It arises from nearly the whole of the surface except the it is wrongly pronounced except at the border. It will be except at the border. So the subscapulary muscles arises means originated. Origin of the subscapulary muscle, the whole surface, costal surface muscle, except near the neck of the spine. It will be neck of the spine. Here is the neck of the spine. Okay, this one is the neck, except, and the second one is the serratus anterior. Is inserted on the surface along the medial border. The serratus anterior muscle is insertion. The subscapular muscle originated and the serratus anterior muscle is inserted. Now this one. In the this one is the I already told this one is the medial border. This one is the lateral border. This one is the superior border. Okay. Now these are the small these are the small portion which you have to know for the details, not in the PPT related. You have to know about details in the MBBS part. Okay, you will know these two muscles. It will be enough for PPT level. Okay. Now the next portion, the dorsal surface. The dorsal surface is divided into two halves, self-right projection called spine. Mainly, the dorsal surface is divided into two halves. One, the upper smaller part is known as the supraspinatus fossa. The lower larger part is known as the infraspinatus fossa. Okay. Now we will see the two half of the dorsal surface. Okay. Here comes. This whole portion is the dorsal surface. This whole portion is the dorsal surface. Now, this dorsal surface is divided into two halves. Here comes the spinous. The spinous process divides the dorsal surface into two halves. The upper half is known as the supraspinatus fossa, and the lower half is known as the infraspinatus fossa. Here, already known as the supraspinatus fossa and infraspinatus fossa. The upper half is divided into two halves by the spine. Okay. Now, the two fossa communicate with each other through the spinoclinoid notch, which lies between the lateral border of the spine and dorsal axis of the neck of the scapula. Through this knob, suprascapular nerves passes. Okay. the spinoclinoid notch. You will see in the practical bone, which you will see not in the book. You will see the spinoclinoid notch, which is difficult to see the spinoclinoid notch in the book. You will see the practical purpose where you have bone in your hand. Mainly, the two fossa communicate with each other through the spinoclinoid notch, which lies between the lateral border of the spine and dorsal aspect of neck of the scapula. Yeah, the two fossa communicate. Yeah, mainly this one. This one is the notch. Okay, but that two fossa communicate with each other through the spinoclinoid notch. Now, we'll see the attachment of the muscles. Origin of the following muscles: supraspinatus from the medial tutor of the supraspinatus fossa, infraspinatus from the infraspinatus fossa, teres from upper tutor of the flattened part adjoining the lateral border, and teres major from lower oval part adjoining the lateral border below the teres minor, and latissimus dorsi from the dorsal surface of the inferior angle. Now we'll see here the 5 muscle attachment: supraspinatus, here the supraspinatus, this one, oh, this one is the infraspinatus, the teres minor. Okay, here from the upper two-third of the flattened lateral border adjoining part of the there teres minor, here teres major, the lower part. Okay, again we'll see supraspinatus, infraspinatus, teres minor, teres major, and latissimus dorsi. Here near the inferior angle, the latissimus dorsi. Here, the latissimus dorsi. Okay, so in the costal surface, two muscles mainly in the costal surface. Okay, subscapularis muscle, the whole portion, and the serratus anterior muscle from the medial border. And in the another thing, the subscapularis muscle is originated and the serratus muscle is inserted from here. Okay, but in case of this, all the 5 muscles, I will tell you, all the 5 muscles, all the 5 muscles are originated from where? From the dorsal surface. Okay, here comes the muscles from the supraspinous fossa, is supraspinatus, from the infraspinous fossa is infraspinatus, from the upper two-thirds of the position is the teres minor. From the lower part or the lateral border is the teres major, and yeah, this one is teres minor, this one teres minor, teres minor, this one is teres major. So this whole portion will divide into two halves. Again I will show you this whole portion is the lateral border. It is divided into two. This one is 2/3 portion and this one is 1/3 portion. Here these two, from this 2/3 portion, the teres minor, the teres minor muscle is originated, and from the lower 1/3 portion that the teres major muscle is originated, and from the lower inferior angle the latissimus dorsi muscle is originated. Okay, now we'll come to the borders. Read about the surfaces. Now we'll come to the borders. How many borders are there? Already told you how many borders are there. 3 borders are there: lateral border, medial border, and superior border. Okay, the lateral border is also known as the axillary border because it lies beneath the axilla. Okay, it is the thickest of all border. It extends from the lower part of the glenoid cavity to the inferior angle. Okay, it extends from the lower part of the glenoid cavity to the inferior angle. Lower part of the glenoid cavity means here, yeah, the lateral border extends lower part. This is the glenoid cavity, and this is the lower part of the glenoid cavity. It runs from the lower part of the glenoid cavity up to the inferior angle. This one is the inferior angle. Okay, and number 3 point is the infraglenoid tubercle, a rough raised triangular area beneath the glenoid cavity is known as the infraglenoid tubercle. Not see in this yeah, beneath the glenoid cavity there lies the infraglenoid tubercle. Now here comes the origin of the following muscles. Teres minor muscle from upper 2/3 of this border on the dorsal surface also. Okay, teres major from the lower of the dorsal surface between the from the lower 1/3 of the dorsal surface. Between the two muscles is a groove for circumflex scapular artery, which is a branch of subscapular artery. Between the two muscles, there is a groove called as the circumflex scapular artery, which is a branch of the, okay, teres minor and this border is upper 2/3. Yeah, which is in between these two teres minor and this is teres major. Okay, this one lies the groove. This one. Again, you will see the gap between this teres minor and teres major. This one is the groove, which is known as the which from where the circumflex scapular artery goes. Okay, And last is the triceps brachii, the long head of the triceps brachii muscle originated from the infraglenoid tubercle. I already saw the infraglenoid tubercle. Yeah, this one, right? Long head of the, right? This one of the triceps muscle. This one is the infraglenoid tubercle. Okay. Now the second border will come the medial border. The medial border is the longest of all border. It extends from the superior angle to the inferior angle. The attachment, the insertion of the muscle. In the uh, lateral border, we can see the three muscles which originated. Yeah, okay. Teres minor, teres major, teres minor, teres major, and triceps. And from the medial border, three muscles we will see which is inserted. Okay. Number one is levator scapula, rhomboideus major, and rhomboideus minor. What are the levator scapula between the superior angle and the spine. Between the superior angle and the spine is the levator scapula. Yeah, it is the superior angle. This one is the superior angle, and this one is the spine. In between the superior angle and the spine, that lies the levator scapular. The rhomboideus minor, opposite root of the spine, opposite root, right? The opposite root of the spine, rhomboideus minor. Yeah, opposite root of the spine. Here comes the opposite root of the spine. It's rhomboideus minor. Okay, and the rhomboideus major comes between the spine and the inferior angle. Rhomboideus major inserted in between the spine and the inferior angle. Here comes the spine and the inferior angle. The rhomboideus spine and the inferior angle. This one is the inferior angle and this one is the spine. In between spine and the inferior angle, the whole the muscle inserted is known as the rhomboideus major. Okay. Now comes the number 3, the upper border. Upper border is thinnest and shortest of all border. Start from the superior angle, extend from the lateral to the suprascapular notch, converted into the foramen by superior transverse scapular ligament, which separates it from the root of the coracoid process. From where the upper border starts? From the superior angle and extends laterally to the suprascapular notch. See, starts from the superior angle and extends lateral to the suprascapular notch. You will see. Starts from the this one is the whole with the upper border. This one is the superior angle. Starts from superior, and this one is this notch. You can see. Yeah. This one is the notch. From here is to here is the upper border. Okay. Here, the only one muscle is originated, the infra belly of the omohyoid near the suprascapular notch. Only one muscle is originated. It's the omohyoid muscle. What muscle? Omohyoid muscle. Okay. Yeah. Yeah. This one. This one is the suprascapular notch. Okay. Sorry. Now comes the angle. There are three angles: inferior angle, superior angle, lateral angle. Found where the lateral and medial border meets, it lies to the opposite 7th rib. The inferior angle lies opposite to the 7th rib. Means there it formed where the lateral and medial border meets. Okay, first point. This one is the medial border, this one is the lateral border. And here meets. Here meets. So this one is the inferior angle. Okay. And the second point, it lies, this inferior angle lies parallel to the 7th rib. Okay. Now, here is only one muscle attachment is there. The latissimus dorsi muscle arises from the dorsal surface of this angle. Okay. Now comes to the next portion is the superior angle. It lies at the junction of the superior and medial border. It covered by the trapezius muscle. The whole superior angle is covered by the trapezius muscle. Yeah? This one is the superior angle. This one is the superior angle. Okay. This. And the lateral angle, the most important is the lateral angle. The lateral angle, it pierces the glenoid cavity. The lateral angle is also known as the glenoid cavity, which articulates with the head of the humerus to form the shoulder joint, also called at the head of the scapula. The floor of the cavity is lined by the hyaline articular cartilage. The neck is constitute part of the adjoining head. Beneath the glenoid cavity, there lies the neck of the scapula. Okay. Now we'll see this one. This one is the glenoid cavity. This one is the neck of the scapula. This glenoid cavity is also known as the lateral angle. Okay. Now another part is this glenoid cavity. This glenoid cavity articulates with the head of the humerus and form the shoulder joint. Okay, the most important. Now, and beneath the glenoid cavity, there is a supraglenoid tubercle, a small rough area above the glenoid cavity is the supraglenoid tubercle. Small rough area. You will not see from here. Practically, when the bone will be on your hand, you will see a rough area. Okay. Now the attachment. The long head of the biceps arises from the supraglenoid tubercle. Infraglenoid, there is the tricep muscle, and the supraglenoid is the biceps brachii muscle. Infraglenoid, long head of the triceps, and supraglenoid is the, see, yeah, this is infraglenoid, this is this one is infraglenoid, and this will not see from here, the supraglenoid, the biceps muscle, long head of the biceps muscle, and the glenoid labrum. It is the to margin of the glenoid cavity. It helps to deepen the glenoid cavity and provide the better articulation. And the capsular ligament, number 3 point, is the capsular ligament of the shoulder joint. Capsular ligament of the shoulder joint. Okay. Number 4 is the processes. How many processes are there? Already told. 3 processes. The first one is the spinous process or spine of the scapula. Spinous process or spine of the scapula. It is self-like projection on the upper part of the dorsal surface of the scapula. It is triangular in shape and it also has 3 borders. The scapula or spine of the scapula also has the 3 borders: lateral border, anterior border, posterior border. The posterior border is also known as the crest of the spine. Okay. The lateral border is free, thick and rounded, bound the spinoclinoid knots which transmit the suprascapular vessels and nerves into the spinous fossa. The anterior border is fused with the dorsal surface. Now, the spine process also has the 3 borders. Let's see. The spinous process also has a lateral border, anterior border, and posterior border. This one is the lateral border, and this one is the anterior border, and this one is the posterior border. Okay. And also it has the 2 surfaces. Which one? The spinous process. Itself the spinous process has 3 borders and 2 surfaces. 3 borders lateral, anterior and posterior. The 2 surfaces are the upper surface and lower surface. The upper surface is concave. It helps to form the supraspinous fossa, and the lower surface is convex, which helps to form the infraspinous fossa. Now, the attachment. From the spinous process, the deltoid posterior fiber arises or originated from the lower lip of the crest. The trapezius muscle inserted into the upper lip of the crest. The supraspinatus arises from the upper surface of the spine. The infraspinatus arises from the lower surface of the spine. Now, the second portion is the acromion process. The second process is the acromion process. The acromion process arises nearly at the right angle from the lateral end of the spine and project forward, and it is subcutaneous and overhangs the glenoid cavity. It also has 2 borders, lateral and medial. Lateral border continues with the lower crest of the of the spine at the acromial angle, and the medial border is short and continuous with the upper lip of the crest, and also has two surfaces, upper and lower. Okay, which one is the acromial process? Yeah, this one is the acromial process. See, this one is the acromial process, and this one is the coracoid process. Okay, and now we'll know the muscle attachment in the acromial process. Okay, the middle fiber of the deltoid arises from the lateral border, trapezius insertion of the medial border behind the facet, coracoacromial ligament to the medial aspect of the tip, and capsular ligament of the acromioclavicular joint. Okay, now the third process is the coracoid process. Okay, coracoid process arises from the upper part of the head, the cavity and scapula. It lies below the clavicle. At first it ascends slightly upwards and medially, and then abruptly bends forward and laterally. And then it is divided into ascending and horizontal part. The horizontal part has lateral and medial border, upper and lower surface of the head. The lower surface related to the subcoracoid bursa and subscapularis muscle. The upper surface sorry the major muscle attachment of the coracoid process are the pectoralis major, insertion, coracobrachialis, origin, short head of the biceps origin, and next one is the coracoclavicular ligament, the conoid part, the trapezoid part from the trapezoid ridge of the upper surface, and the coracoacromial ligament, coracohumeral ligament. These muscle attachment are most important for the exam purpose. Okay. Now today's topic is over. If you have any query, please comment.